So what are some of the pitfalls that maybe some businesses might run into when they're looking at distribution?
Yeah, they're constantly underestimating, believe it or not, the ease of it or the importance of it. It's execution. Execution is so very important, but if it's not on shelf, it's not for sale.
Yeah.
Nobody cares about Marion Roberts juice if it's not on shelf.
Right.
So distribution trusts us, and so does retail, and our team is incredible.
Loft 100 Studios, the Big Biz Show, and our affiliates and our hosts are not registered investment advisors or broker-dealers.
Our show hosts make no commitment that the purchase of securities of companies profiled or otherwise mentioned in our programming
are suitable or advisable for any person, or that an investment in such securities will be profitable in general.
Given the nature of the company's profile and the lack of an active trading market for the securities, investing is highly speculative and carries a certain high degree of risk.
We profile selected publicly traded and privately held companies on our program.
Most of these companies that we profile have provided compensation to Loft 100 Studios and its hosts for the profile coverage.
From time to time, we sell shares of the companies profiled in the open market that we receive as compensation for coverage of client companies.
But never sell stocks if we are speaking about interviewing or covering a public company who has paid compensation.
Specific questions on compensation can be obtained by contacting producer at sullyandgroup.com.
Listeners should verify all claims and do their own due diligence before investing in any securities mentioned on this program.
Investing in securities is speculative and carries a high degree of risk.
We encourage our investors to invest carefully and read the investor information available at the websites on the
Securities and Exchange Commission at sec.gov and or the Financial Industry Regulatory Authority, FINRA, at www.finra.org.
I like it.
Well, we march on today, Big Biz Show. Welcome, Bloomberg Financiero. 15 million homes in Mexico, as well as our 110 million homes in the U.S., thanks to BizTV and American Life Network. And of course, we're simulcast on radio, iHeartMedia, and American Forces Radio Network in 175 countries and all the ships at sea. God bless our military men and women serving their country overseas and underway. Mike tried to make me say underwear, but I didn't.
No, didn't say it.
Said underway. Great to have along, of course, our in-house band, the DTC. T. Okay, well, first of all.
Uh-oh, I didn't see it too, sorry.
You know what, you need to know.
Fist pump.
We try that one more time, please? Okay, pick it up, please.
Pick it up one.
5,
2,
6, 7.
Yeah.
Here we go, watch me.
Okay.
Ish, huh? It was ish.
One day.
It was ish, huh?
One day.
It is. Great to have you along today. Dr. Tom Vo is the CEO and chairman of the board for a company called Nutex Health. We had him on the air, I think it was once or twice prior. I love his story. I would love to have him back every week because it's so interesting. We're talking about micro hospitals, staff burnouts, value-based care, and the big issues in healthcare. I think most of us have sort of figured out how we're going to navigate our doctor's appointments and our visits, but one size does not fit all. It depends if you're with Kaiser or you're with a PPO or an HMO. Here to talk about what they're doing to solve the problem is Dr. Tom Vo. Tom, great to have you back, sir.
Yeah, hi, Sully.
Good to see you.
Great being here.
Hey, can you give us a top-down of what Nutex, what is your business model, and then let's talk about where you're at with it right now.
Yes, our business model is that we build small hospitals around the country. We put these small hospitals wherever there's a big need, where the patients need us the most to bring accessibility to the hospital. So essentially, we identify areas where there's a big need, and then we try to fill that void.
Here's my next question. Is a small hospital more efficient than what we're used to, the de rigueur, so to speak, of big city hospitals? And I'm assuming it is because less people, less weight, and more granular service, so to speak.
Yeah, that's right. These are small hospitals, but they're still a hospital. They basically have all the bells and whistles of a hospital, and they're licensed in every state that we're in. And so, as with other hospitals, we have an ER, we have imaging suites, we have lab, radiology, pharmacy, so on and so forth. And so, we basically could service and treat, I would say, 95% of everybody that walks through the door. And the rest, we transfer out to the much bigger hospitals that has a lot more service lines.
Hey, Tom, with respect to the hospital side, when you're dealing with, as you mentioned before, staff burnouts and, of course, all the things that go along with big hospitals, is it a better experience for the worker and the doctors and nurses and everyone else if it's a smaller hospital?
No, absolutely. It's all about the culture that you bring, right? Our culture is very, very gentle, very nice to the staff. We bring the passion and the enthusiasm for the staff to come back and work with us. And ultimately, the bottom line is that if you have happy staff, you're going to have happy patients. So that's what we bring to the table.
You brought up something last time you were on the air that I want you to define again. It's called value-based care. Okay, that's something I haven't heard about before because I'm not really price shopping when I'm going to the hospital. Although maybe we should when you get the bill back, when you realize that you spent 5 figures on something. Talk about value-based care, the definition, and how you guys are tackling that.
Yeah, value-based care is essentially you're trying to save insurance and the community and society money when you treat patients. So in other words, the way that we do it is that we give the provider a fixed amount of dollar, let's just say per member per month. And so the provider has that fixed amount to treat his patients. And so obviously the healthier that provider keeps the patient, the less cost it is to society, and in turn basically incentivize the provider to basically make more. So that's basically what value healthcare is essentially. So there are a lot of companies out there doing the same thing that we're doing.
What I want to know from you two guys, would you rather go walk in your bank or walk into a medical appointment as far as hassle goes?
Bank any day of the week. Yeah.
I'd say hospital.
Really? Really?
What is the other one? Would you rather be on hold with customer service on your credit card? Because there is this sort of, you get that nervous stomach when you got to go to a DMV appointment. Like it's because how long am I going to be here? What kind of time suck? And then you go to a hospital, and of course if you go to ER, it's a crapshoot. You could be there for 1 hour or 7 hours. But the other thing too is they've created this thing called concierge healthcare, which some people subscribe to, and it's a few $1,000s a year, but it means that if you set an appointment for 3:15, you're in front of the doctor at 3:15. Now, I would assume that there's no need for the concierge healthcare with a smaller hospital, mainly because of the way the model works. So I'm thinking there's more personalized care. Am I accurate there?
No, that's 100% correct. I mean, and so our model is already by itself concierge medicine already. So you don't really need to pay an extra service for doing that. That's correct.
For you guys, what's next for you? I know are you building more hospitals, or are you servicing the existing hospitals?
Both. So we have about 22 locations that are open right now in 8 states. We have probably another 15 to 20 locations that are under development, and will be open in 2025. So we're probably going to double our size in about 2-3 years. And so we're excited about opening all those locations in areas where there's a need. For our existing sites, we're adding new service lines. We're adding basically more marketing to increase more patient volume. And some of the service lines that we're adding are basically what society needs, and that's, for example, increased accessibility for mental health. As an example, that is a big problem in the society right now, where a patient can't get access to, say, a psychiatrist, as an example. So with our hospital being a functioning hospital with an emergency room and all the bells and whistles that a hospital has, we're positioned very well to provide those new service lines to the communities that we serve.
Hey, Dr. Tom Vo is our guest. If we talk about, we can all complain about emergency room waiting periods or waiting room periods for our doctors and so on and so forth. What do you think the main issues are and problems are in healthcare, and how are we doing to sort of solve those problems?
Well, I mean, the main issues are like what you mentioned before: the staff burnout. We don't have enough staff, nurses, and doctors to treat everybody in the country. The cost of healthcare, as an example, and accessibility. And so Nutex Health is basically tackling all three of those at the same time by expanding our service lines around the country and expanding our hospitals and meet the patient needs.
Tom, what's next for you guys for the rest of the year and going forward for the next 18 months, in as much as you can tell us as a CEO of a public company?
Yeah, no, I mean, it's all public. I mean, we have about at least 2 to 3 new locations that we're going to open up this year. and working on launch a few new service lines for some of our existing hospitals, including the including the psychiatric service lines at a few of our hospitals in Texas.
Tom, let's get you in studio. Let's get you over to San Diego. Have you on as a regular guest. Thanks, pal. Appreciate it. Dr. Tom Bowe is his name. Where'd you find him? Did a shareholder?
Yeah, a viewer. Yeah.
I just want to say, I love the logo.
Yes.
I love his silhouette.
Yeah.
It was leaning towards Hydra in James Bond, especially when it was next to the map showing where they're going to drop the bombs. But fantastic company. Nutex Health, NUTX, Big Biz Show continues.